Oh, really? Yeah. Hey, Jennifer, good to have you. Yeah.
One more like
Hey, Sherry.
Okay. Good evening, everybody. Thank everyone for being here. Appreciate it. Today is August 24th, 2022, and it is 5:01 p.m. As a form of the committee is in attendance, I'd like to call to order the meeting for the Central Health Executive Committee. We will receive public communication for both the executive committee and the board of managers meeting before we proceed to the executive committee agenda. Members of the public who wish to make comments during the public communication portion of the meeting must get registered with Central Health via the online form or by telephone no later than 3:30 p.m. today. Christian, did anyone register to make comments for either the executive committee meeting or the board of managers?
Yes, Mr. Chairman. We have 5 people who wish to speak for public comments for the Board of Managers meeting. I will now read the guidelines.
You're muted, Christian.
Sorry, can you hear me now? Can you hear me?
Lights up.
Hang on, I'll page Mike.
Is my audio not coming through?
Not hearing any audio.
Okay.
Ambient speakers are on, but what's coming through the
Yes, we can hear the remote participants, no problem. So.
Is my audio coming through now?
We're trying to fix the problem.
We didn't have a problem hearing the other folks in the room, so we know the audio is going in okay.
Can you hear me now? Let me try to switch over.
Can you want to try again?
Yes, can you hear me now?
No, we're still not hearing you.
Okay.
Is my audio coming through now?
Not yet, Christian.
Okay. I'm trying on a couple different devices. Can you hear me now?
We can hear virtually. I think it's the boardroom that's having the issues.
It is. That's correct.
Oh,
It's the speakers in the boardroom. We can't get it to broadcast over the speakers.
okay. Well, I feel a little bit better about myself now. Okay. Let me know when the boardroom speakers are ready. We have 5 people signed up to speak today.
If I may, as a workaround, suggest that we come back to public communication. So we can still have the board meeting,
Okay.
or excuse me, the executive committee meeting, and then we'll circle back around as soon as we get a green light. Because we may have to log out and log back in.
Okay.
To reset something.
Thank you, Mr. Eastland. What we're going to do is to
Postpone public communication at this time, and we will come back once our technical difficulties have been resolved. Okay.
Actually, now we're going to.
Item number 1, approve the minutes of the Central Health Executive Committee, June 15, 2022. Do I have a motion? I have a motion from Manager Zuniga. I have a second.
Now it's working. Sorry.
Turn it off.
Testing.
Okay. I have a motion from Manager Cynthia. I have a second from Manager Valdez. Any discussion? Will be presenting.
Okay, so I will go over the August 31st and the September agendas. So starting with the August 31st public hearing, we'll have an overview of the FY23 budget and associated tax rate, and we'll receive public comment on that. And then on the regular board agenda for that meeting, we'll have the community engagement report and a tentative real estate update. And then moving on to September, we currently have a strategic planning committee scheduled for September 7th, along with executive committee and the board meeting, but we only have one item scheduled for that strategic planning committee right now. So if it stays that way, we will just move that into the regular board meeting. And that's an enterprise branding update, a vote on a recommendation to the full board. Executive committee will have tentative schedules and then integral care reappointments. And then the regular board meeting on consent will have minutes, investments, the integral care reappointments. We will have a vote on the FY23 budget and priorities and tax rate, the CCC budget approval, and we will include the Q3 fiscal and operational updates from CUC and Sendero in the email that goes out with that packet. We will have HR updates and then a tentative Sendero update and a partnership update. And then I will pass it on to Mike.
Yes, so members, briefly, for September 7th, the executive committee meeting, there's some items that we'll bring back. Again, I just wanted to get this on your radar screen for awareness, and we'll talk more about them in depth at the September executive committee meeting. But two things for future agenda staging. One is to discuss governance structures. You'll recall the 5-year performance review from 2018, that there were some governance structures that needed to be discussed at some point. So we'll need to bring that back to you. Again, that's for staging for future agendas, not for deliberations in executive committee meetings. Second, looking at, and this is pursuant to a conversation from budget and finance with among board members, but particularly with Manager Jones leading off on the discussion, to go back and figure out where we pull in the narrative on the history of the healthcare district and some of the key milestones as part of that narrative, and including that in future agenda staging. But those are two things that we'll come back and talk more about, but wanted you to think about it in the meantime. Thank you.
Thank you, Mr. Beasley. Fair enough. That's it. All right. Any questions or comments? Manager Greenberg.
I'm looking at the page, looks like 15. I don't see the August 31st meeting on here. Just
It's down at the bottom.
is it? Am I missing it? I
set up on the
I see
screen.
the 24th.
It's the 24th, and then the column
Goes to the next.
right
Thank
below it.
you. Okay, that's what I needed to see. Thank you.
You got it? Okay. Any other questions, comments? Oh, I'm sorry.
That's okay. That's okay.
Manager Valdez.
Yes, Mr. Beasley, if there are any suggestions during the public hearings that are going to ask for either a commitment of staff or expenditures of money, or at least a place setting, a place card holder for placeholder for dollars during the upcoming fiscal year, how we're going to handle that? Just put just leave it alone and wait until it comes up during the following fiscal year, during October, November, December, whatever?
Well, that depends. So on the topic of future budget items is part of the discussions for this and the public hearing and the rest of the budget hearings. Let me preface this by saying there was a lot of outreach in the community, especially around the healthcare equity plan through the voices of the community to build the budgets that you're going to see, that you've already seen and that we'll see tonight and then throughout the rest of the budget related meetings. But there are ideas that come up in the meantime, you know, after the budget's been developed and presented. And so as a board of managers, you have some options here. To the extent that it involves the budget that's been presented, you can get clarification on, is this the sort of thing that we're going to be investing in? Because it could be that it's already happening. It's just packaged differently. It's set differently. If it's a new spending item that hasn't been contemplated and it changes the structure of the budget, then that's something that would have to go through some level of analysis and business case. And at this juncture where we are, that will be difficult to do prior to the final vote. And so it's one of those things where we would tee it up as a business case for the next fiscal year so that it can get the level of analysis around it, but then in voices of the community and input so that we can properly develop it for some type of recommendation to potentially be included in a future budget. So those are my general response, but I hope that's responsive to.
Thank you.
Thank you. Manager Jones?
Yes, two things. One, thank you, Mr. Beasley, of talking about the opportunity to be able to talk about not only the past in terms of the central health, but also strategies for where we go forward. So I will make sure we identify that we will incorporate that in that. And the second thing, did you want to respond to that?
Oh, no, I understood. I just mentioned that because there's where we're going in the future is being built into other work streams, especially on the 1 to 3 year operational plans, but also the performance review that's coming up.
Right.
So that future piece, I felt like I didn't mean to say that by not mentioning that wasn't going to be part of the discussion. It's just
yeah. I assume. I just want to make sure. The second thing.
That noise was not my response.
The second thing is sort of a piggyback off of Manager Valdez's question: is there an assumption, let's say by board members, that you all have incorporated into the budget process some initiatives or new initiatives that we may be interested in inculcating in the budget by way of community conversations and other things, given that we still have on the 31st a public hearing that will look at the budget. So is there still opportunity to make some suggestions or incorporate at that time?
As a board member, there's, anytime that the budget has been properly moved and is up for discussion, as a board member, it's your prerogative to have whatever discussion that you want to have. Also at appropriate times, and subject to legal counsel and the chair recognizing everybody, you've got the opportunity to make amendments, not only to the budget structures, but also to the budget resolution, which really is the point where the numbers, if you will, the dollars culminate with, are lined up with the strategic goals that have already been established by the board.
All right. Okay.
Let me pause here before I keep going because I want to make sure that's responsive to
right.
To your
yes, it is. So we will have the opportunity either at that meeting or sometime between the final adoption is to incorporate the resolution into the resolution any initiatives that we think we would like to incorporate based upon the budget process that has been brought up to date.
If it's not already in there, yes, sir.
Yes.
But let me just say as a practical matter and to be fully, forthcoming, what you've been presented here already, we'll discuss again this evening. They're started with the voices of the community, even back around the first of the year, and probably even sooner. I'm probably not quite got the past several months, there was a lot of public engagement. We've recently circled back around through our community conversations and also voices of the community meetings to reconnect with those individuals that provided us input. MAP patients, prior MAP patients, around, hey, this is what a high functioning healthcare system looks like. And so we've already, again, we've actually circled back around twice now and said, hey, we've heard you, we've looked at the data, we've heard your voices, and this is what we're going to be investing in to build a high functioning healthcare system. Let me just say, for hypothetical purposes, not to belabor the point, Mr. Chair, but if there is something new that is going to be proposed that is significant, and it's building out something that we haven't discussed with the voices of the community, or maybe that is so big it overrides what the voices of the community and community conversations have conveyed to us. And as a board of manager, like I say, it's always a prerogative to put a discussion out there when a budget has been properly moved, but also to make an amendment as previously discussed. Our ability to put together new programs that are not aligned with the healthcare equity plan, the community health needs assessment that was performed, the community conversations, that window, for all intents and purposes, is closed, I should say, to be honest about it. And that's why, in response to Manager Valdez, I'm thinking, okay, if there's something that comes up that's big in scale, something that comes up that's big in scale, then that's something that we're just going to have to pull into the processes for the next fiscal year.
For the next fiscal year.
Yeah. And I follow, and I understand. It's that definition of within the framework of what we've discussed. Initiative is what I'm always just trying to get at. So if there's something we've discussed under the, for instance, the equity initiative,
Yes,
that we'd like to incorporate in the budget as the process, is that the time to do that as well?
If it hasn't already been incorporated.
If it has
it's
not
not
been,
already incorporated in the budget. You're talking about the dollars of the budget resolution.
the dollars.
Well, the dollars are there.
Yeah.
For everything that the board has outlined.
Yeah.
Under the healthcare equity plan, we funded for it.
Okay, so if we want to do another if we want to enhance that, is that the opportunity to do it at that time?
Well,
The definition of enhanced.
Add dollars to it.
so
Forgive me, my days at the city of Austin, council members, no, we're not council members, but would have the opportunity at the last minute to incorporate. I know we're not there, but I'm just saying, is that opportunity there with this process?
So when we discuss the budget tonight, it would probably help all of us do a better job of answering your questions if we could see or hear what it is that you're thinking. Because right now, and this goes back when we first started the budget process, we did a multi-year projection looking at what the tax rates would be. And so we get some kind of estimate about what the revenue looks like.
Right.
And then when the confines of that revenue, then we start building out the budget knowing, oh, this is the amount of revenue that we're going to have. And so if it's something that contemplates additional revenue, that's a much more complicated conversation to be upfront about it than something that involves, perhaps maybe a reallocation from specialty care reserves to primary care reserves, let's say.
Yeah,
I'm using this.
I follow. Okay, then. Well, I think you've answered the question. I just wanted to make sure I understood it. Thank you.
Yeah.
Thank you, Manager Jones. Manager Musaiki.
Thank you. Just, if you can remind me, didn't we develop something, you had allocated additional money in the strategic committee for such projects for people to fall in? So I think we had a streamlined process. So if people wanted to bring forth an initiative, there is a process we have in place. Is that correct?
That is correct. And I think it's got an acronym name.
Yeah, I forgot.
SHIFT. I'm not sure what the acronym means. But yes, that is the
So that's
mechanism.
also a reminder, a mechanism for other community members to access additional money if they have a specific project in mind.
But especially along the guidelines of the RP.
Correct.
Right. Okay. Any other questions? Hearing none, I'd like to ask the technical folks, are we ready for public communication? Okay. I will now go back and read the announcement for public communication. We will receive public communication for both the executive committee and the board of managers meetings. Before we proceed, members of the public who wish to make comments during the public communication portion of the meeting must have registered with Central Health via the online form or by telephone no later than 3:30 p.m. today. Christian, did anyone register to make comments for either the executive committee meeting or the board of managers meeting?
Yes, Mr. Chairman, there are 5 people who wish to speak for public comment for the Board of Managers meeting. I will now read the guidelines for this meeting's public communication. When called upon to speak, please introduce yourself by name before beginning your comments. Also, if your comments will focus on a specific item or issue on the agenda, please indicate the full item number. Each speaker will be limited to 3 minutes. Staff will be timing each speaker and will announce when a speaker has reached their time limit. To ensure the efficiency of the meeting, once we have let speakers know that they've reached their time limit, we will allow 30 more seconds to wrap up their comments before they are muted. Due to the restrictions of the Open Meetings Act, the board may be restricted in discussing any items that are not listed on the agenda for this meeting. The board may choose to set aside any new issues for discussion at a future meeting. We received 5 submissions for public comment via our online portal. 3 will be speaking online and 2 will be speaking in person. At this time, I will call upon our first speaker, Mary Dale.
Good evening. Can you hear me?
Yes, we can hear you.
Okay, great, thank you. My name is Mary Lopez Dale. I am the COO for Family Hospital Systems, which is a small hospital system in Central Texas. We operate 4 freestanding emergency rooms and 2 micro hospitals in the area. I am looking for the item number, and I apologize, but my matter is concerning the potential increase in the tax for the LPPF fund. And I appreciate board for giving me the opportunity to speak tonight. And I do appreciate the efforts that are being made by our community and our legislators to think outside the box to offer better healthcare options to Texans. And that is actually the very idea upon which this company was built as well. So I do have a letter that I would like to read into the record, in which I wish to express my concern for the proposed 6% of net patient revenue for Travis County inpatient hospitals. While well-intentioned, this would pose a serious burden on facilities that have continued to deal with the dire fiscal impacts of COVID-19 and the ongoing treatment for uninsured patients. Small facilities and independent hospital systems like Family Hospital Systems do not directly benefit from the local provider participation funds, although we pay into it. Our facilities absorb the cost of treating the underinsured and uninsured without any compensation. During the pandemic, we did our best to meet the public's healthcare needs. We expanded our service capabilities per Governor Abbott's request and the declared state of emergency. Despite doing the right thing by answering the governor's call and subsequently being recognized as a state designated hub for related services, promised payments for COVID-19 testing have been held up. We provided over 160,000 vaccinations in the Central Texas area. We are waiting for officials to give guidance on how many will be distributed to those of us providing COVID-19 testing and vaccines while continuing to treat the underinsured and uninsured with no guarantee of reimbursement. Unfortunately, the situation is as tenuous for treating the uninsured as it is for treating those patients who carriers consider us to be out of network. To be put in perspective, our hospital network doing business as Family Hospital Systems is out over $4 million from the vaccination program alone. While we did take significant pride in being able to help our community, we want to continue to do so and keep our doors open. Many of our service lines suffered during the pandemic because of our need to test, treat, and vaccinate against COVID-19. Family Hospital Systems has tried to make up for lost revenue without passing the cost to our patients. While unintended, it certainly seems as though Central Health is choosing winners and losers with this tax through how it's being implemented when larger healthcare systems are the beneficiaries of the plan as it currently exists. Keep in mind, these are likely the same hospital networks that benefited from federal loans and subsidies that the smaller health systems, again, did not qualify. Further, smaller independent systems like FHS are losing money under the current program because the costs associated with the payments and the administrative cost, which amounts in tax on top of the tax. The healthcare sector faced many burdens under COVID-19. Many facilities have laid off staff to attempt to stay in business. The level of the proposed tax increase is just another more example of the healthcare industry facing a setback on our perceived road to recovery. Again, while the intent of this program is laudable, the implementation of the proposed tax increase would hit small and independent providers disproportionately. I would urge the health district to reconsider by discerning between small and independent providers who do not receive payments by lowering the payment rate as a percentage of net patient revenue. Alternatively, the rate might be cut to be more reasonable for smaller hospitals with less than 25 beds, for example. In closing, more flexible, reasonable implementation of the program is necessary for the survival of small providers, which in turn ensures competition, choice, and access for many Texans. Not all patients are alike, and neither are hospitals. To give Texans, I'm sorry, I'm done?
Yes, that was the end of the extension.
Thank you.
Mary, you can finish up your last sentence and then close it up.
Great, thank you. So to recap, to give Texans the proper and thoughtful medical care they deserve, we will need to find a better way to work together. Thank you for your time this evening. I look forward to continuing this dialogue.
Thank you very much for your comments and concerns. We appreciate that, and we'll definitely give them consideration.
Thank you.
Christian, the next.
The next speaker is Lori Renteria.
Hello, my name is Lori Beth Renteria. I live in the neighborhood, and I have for probably 40 years. And I appreciate my good friend Cynthia Valdez representing my community for all these many years. I'm here as a member of an advisory group who is trying to create an intergenerational resource and activity center that will primarily serve residents, low-income residents who reside at the RBJ Tower on Town Lake by the I-35 bridge. Mm-hmm. Central Health was involved early on in 2016, along with St. David's and the University of Texas LBJ School for Public Policy around Health, in doing some research, intensive research. And in 2016, Central Health wrote a letter of support and commitment that you wanted to be very much involved in creating this intergenerational center. I believe there was also some communication between Dr. Angel, who is the primary research person at the LBJ school, with a person named Jason Fortnier here. And we got another letter of support from Central Health. Well, the pandemic hit and we got really sidetracked by the city of Austin. They decided they wanted us to create this pilot project at Dove Springs Rec Center. Well, Dove Springs Rec Center is not connected to a high concentration of seniors, and a model intergenerational resource and activity center is going to need to be right near housing. So we are back to the drawing board with the city of Austin in pursuing the use of the abandoned fire department headquarters right at the end of Comal Street. It's called the Nash Hernandez Building right now. And the city legal has presented a problem saying that we cannot provide any health services and we don't want to be a clinic. All we want to do is basic health screenings, blood pressure, you know, some wellness checks, those kind of things. And there is some kind of agreement that was signed between the city of Austin and Central Health that said that this attorney at the city is saying that no health services can be provided in a city-owned building. Now, we find that hard to believe because Central Health is in a lot of city-owned buildings, Rosewood, 211 Comal. And so I'm asking for three things. First, we want to bring Central Health to be a permanent member of our advisory group. We meet the fourth Thursday of the month at 4 o'clock, and the meetings are still being held on Zoom. The second request is that somebody in Central Health Administration who is very familiar with the interlocal agreement that you have with the city be willing to meet with, I'm the first lady of District 3. My husband, Sabino Pio Renteria, has been asking for a meeting with city legal, not the person, we believe the lawyer is from Austin Public Health.
That's the
We need to meet with a very high level lawyer. So we need somebody from Central Health Legal to be with us in that meeting.
And we'll
And the
ask you
third thing is, we would like for you to write another letter of support and possible commitment in the future, should we need it. In 2016, I believe you said you would provide some health services there for the Intergenerational Health Center. We're probably a year or two away from actually even getting the building rehabbed for the program. So I thank you for your time, and I look forward to some follow-up. Thank you so much.
Thank you very much, Ms. Renteria. Appreciate that. And thank you for your work in the community. Christian?
Yes, the next speaker is Whitney Wild.
Good afternoon. Can everybody hear me?
Yes, we can hear you.
Great. My name is Whitney Wild, and I'm a Director of Government Finance at Baylor Scott and White Health. And I also want to speak on the LPPF rate that is going to be increased to 6% or proposed to. First off, I want to say that Baylor Scott and White is in full support of the increase to 6%. And also I want to thank everybody for the support over the years for the LPPF, because we feel it's very critical and vital to the community and to Travis County. And so I hope you will take that to heart, and thank you very much.
Thank you very much, Ms. Wild. Christian?
The next speaker is Geronimo Rodriguez.
Good evening, Chairperson Bell, Board of Managers. My name is Geronimo Rodriguez. I serve as the Chief Advocacy Officer for Ascension, Texas, one of the largest healthcare systems here in Central Texas. And we are in complete support of the 6% tax assessment on agenda item number 1. And I also just wanted to take this time to say that Ascension believes in teamwork and collaboration, and it'd be remiss on me if I didn't thank you all, Central Health, Austin Public Health, and Community Care, Jason Fornoy, for collaborating with us to create the monkeypox vaccine clinic that happened this weekend. Our staff was the clinical staff out of our medical response unit that provided 1,900 vaccines, and that would not have happened without the teamwork and collaboration that virtually happened within 24 hours. And so really appreciate Central Health Community Care in particular around those particular efforts. And I think as one of the other speakers mentioned, providing vaccines, we're going to report next week that we have provided over 317,000 COVID vaccinations. So again, in support of the LPPF tax assessment of 6%, but also just wanted to note and appreciate
it. Christian?
Okay, so we do have an additional speaker that came in a little bit late, so we'll have 6. The next speaker is Jacob Holt.
Mr. Holt, are you there?
Yes, I'm here. I'm sorry, I guess I was muted. Can
Yes,
you hear me now?
We can hear you now.
Thank you. My name is Jacob Holt. I'm an attorney representing St. David's Healthcare, speaking on item 1 for the Board of Managers regular agenda regarding the increase in the LPPF assessment rate to 6% for the current fiscal year. St. David's is in support of this increase in the annual rate. As you all know, the LPPF is an incredible tool that supports care for Medicaid and uninsured hospital services to patients in our community. And reducing that assessment rate would significantly reduce the federal healthcare funding that flows into the community. So instead, St. David's asks that you increase the rate to 6% for this year to continue the availability of these funds for Medicaid and uninsured patients. Thank you.
Thank you very much, Mr. Holt. We appreciate those comments. Christian?
And our final speaker for today is Sharonda Robinson.
Hello, good evening. Can you hear me?
Yes, we can, Ms. Robinson.
Thank you. Thank you, Chairman Bell, and thank you to the Central Health Board of Managers and to Mr. Beasley. I'm Sharonda Robinson, and in the capacity that I'm serving tonight as the representative of the Black Leaders Collective, wanted to express our strong desire and support for funding that serves the Black Male Health Clinic that is in place in Austin. I don't know how many of you all are aware, but the Black Leaders Collective has a public health issue group. And this is a group of concerned citizens and people who have committed their lives to better health outcomes and decreasing disparities, in particular for our Black community. And we've been meeting for over 2 years to work on issues such as food insecurity and COVID vaccine access, as well as looking at the stark disparities related to morbidity and mortality rates for Black men in our community. And we fully support the work that's happening with the Black Male Health Clinic. It is incredible for us to see people who care and experts in our community stepping forward to say that we are going to close the gap and quite literally save lives. I have 3 Black boys. Well, they're young men now. They don't like me to call them boys. And I know firsthand some of the barriers that our Black men face in terms of accessing healthcare and having service that is reflective of their needs from not only a physical standpoint, but emotionally, socially, and spiritually. And so I know that there is a budget that is being discussed, and it is my hope and expectation that Central Health will do all that it can and more to ensure that we are essentially saving the lives of Black men in our community. I believe the numbers, and I think you all probably know this better than I do, but the lifespan of Black men in our community is about 10 years less than other folks. And so when you compound that over generations, that's 10 years less of income, that's 10 years less of wisdom, that's decades less of the kind of community and the folks in the community that we want to be here. So The short story is that there is a community initiative in place to address the mission of Central Health, and the resources need to follow. And so we ask that you, if it's not in your existing budget, that you include it. And if it is, that you increase what you've already included there. Thank you.
Thank you very much for those comments, Mrs. Robinson. Manager Valdez.
Christian, I called in to speak today to the 512-978-9198. I think that was the number. Anyway, it went to the Central Health answering machine. If anybody could check, I have a proof of that on my phone, but I would like to speak.
I'll allow it. Go ahead.
You have 3 minutes.
Well, thank you very much.
Welcome.
My name is Cynthia Valdez. I sit on the board of managers for Central Health, but more than that, I've been a part of this community for many years. Coming here as a student at UT in 1973, which is probably older than some people on this board, and then leaving for a short time and then coming back. And I appreciated the work that I did with East Austin women, with Concilio and other organizations here trying to secure resources for our poverty and marginalized Latino population, any population, regardless of color and ethnicity. And so I'm here in support of the presentation that was made earlier by Lori Renteria in support of the Intergenerational Resource and Activity Center for seniors that would be housed at the Nash Hernandez building that's just right here, straight down Comal, I think where it dead ends, in that RBJ complex. And I don't think that there would be a better use of resources to be a part of that multi-entity planning process and implementing the goals that they hope to achieve, and that is to provide services to the poverty the poverty population that are seniors now. They've outgrown, they're no longer, they're the baby boomers who are now baby olders population. And I know, I watched a tape where Larry Wallace is presenting to the Central Health Board, to those of us, I was seated right there, and asking us to support this project and this initiative. And then that was it. That there was nothing else said of it. I assumed that it had been implemented. I did not realize that it had not. And so when it was brought to my attention that there was a need, because it had been put on hold, that's why we hadn't heard of it, I immediately said, I will raise my voice in support of this initiative, because it was a commitment we made at Central Health as a board. Way back when, in 2016 and 2018. And so if there's anything that we can do, and our legal staff can do, to make sure that there are no hindrances, that there's no barrier to allowing for the provision of at least wellness checks, preventative strategies to be implemented to our senior population living in poverty, then I think that we need to do it, because we pay a lot of attention to, we are created to serve the needs of the indigent, those that are uninsured and underinsured and working poor. And once you have reached a stage in your life where you can barely move, much less attempt to try and access resources, that there are people dying in their homes, in their little apartments every day. And I'd like for us to please put that back on the front of the line, at least with respect to participating in fully being full partners in this development of this center, and seeing what our enterprise can do to make sure that the needs of this community are met. So thank you. One last quick sentence. Okay, my last quick sentence is not necessarily for this, but because I hear the cries of the small hospital systems and clinics, especially in our rural communities. And if there was a way to implement a step process or look at the taxing under the LPPF based on the number of people you serve, or the number of entities, or maybe your budget. If we can tie it to how much money they have within their budget, I think that's a good indication of what they are doing and what they have yet to be able to achieve. So if we can consider that, I'd like for us to do that too.
Thank you very much, Manager Valdez. We appreciate those comments. I think that staff will look at attempting to be as flexible as we can within the law of the LPPF. And we took those comments to heart. Thank you very much. Is that the end, Christian? Unless another board member is called and got the voicemail?
That I'm aware of. So that concludes our speakers for today.
Thank you. Thank you very much. And thank all of the speakers and you, Christian, for your work in this. Before calling up the next agenda item, I wanted to call the board's attention to the calendar dates regarding the budget development and approval process that's in your packet. There are some dates in September that I just want you to be aware of. And it's on page 17 of your packet. So we've got some fairly critical meetings that are coming up, and again, want you to be aware. Agenda item number 3, discuss the process and timeline for the performance evaluation for the Central Health President and CEO. Sherelle Freeman will be presenting.
Hi, thank you so much.
Sherelle, could you hold on just a sec? Manager Musaiti.
Thank you, sorry. So for the September 8th meeting, are you requiring a quorum of the board to be in attendance in Commissioner's Court? Because you have that date, or is it just? No.
I'm sorry.
I just wanted some clarity.
Could you
Who was
repeat your question
expected to
again?
be there at Commissioner's Court on September 8th? That's my question.
I think that if board members are able to attend, we would like for them to attend. But, you know, we understand that there are many of you that have other commitments and occupations and may not be there. So there's no required attendance, but definitely if you're able to attend, I would appreciate your company. All right. I'm sorry, Sherelle, that I had to interrupt you. Go ahead.
No worries. Okay, so overall, the process for the CEO evaluation will begin in September. So September 12th, what we'll do is send the board of managers the CEO evaluation tool for individual completion. September 19th, the CEO will receive a self-assessment based on the scorecard goals and expectations. September 26th, the board of managers will ensure completion of the performance evaluation. And then September 30th, the VP or their designated person will send the completed and out evaluation to all managers for review. October, a date to be determined, we will send the following, or the board of managers will work on the following action items: deliver the results of the CEO's evaluation, discuss the take action on the completed performance evaluation, discuss and take action on the CEO's merit increase, discuss and take action on the terms of the CEO's employment contract. On October 31st, 2022, the CEO's signature will be due, and a date to be determined will be an approval for the framework for the 2023 performance evaluation for the CEO.
Okay, thank you very much, Sherelle. Any questions or comments from board members? Okay, that timetable is actually in your packet for the executive committee meeting. So please keep in mind that we do need these. When you receive your self-assessment, please return it in as promptly I mean, when, not a self-assessment, when you receive the.
We can do that too.
Yeah, when you receive your evaluation tool, the evaluation tool, please turn it in, I'll return it as promptly as you possibly can. Thank you. All right, agenda item number 4, receive an update and discuss the process for upcoming appointments to Sendero, Community Care, and Integral Care governing boards. Perla Cavazos will be presenting.
Yes. Managers, this memo and agenda item just serves as a for your awareness that we will be putting some agenda items on the calendar for some upcoming appointments to external organizations. This is a responsibility of the Board of Managers. We have community care. There are 2 central health appointees to the Community Care Board. Pilar Sanchez was one of those appointments, and she recently resigned, so the board will have to appoint someone to fill her position. And I did put some recommendations in here to some goals, and ideally we would finalize this appointment by November. Sendero Health Plans, the Central Health Board appoints all 7 members of the Sendero Governing Board. And we have 3 board members whose term is expiring. And then we have another board member who plans to resign, and he's given notice. We are aware that Betty DeLargy and Juan Garza are requesting reappointment, and Sendero is seeking 2 new appointments to replace Mr. Ritchie and Mr. Southard. I think my goal for the board would be to do those appointments by November. Integral Care has reached out to us and is requesting reappointment of 2 board members, Dr. Guadalupe Zamora and Hal Katz. And for now, we have put those reappointments on the September 7th board agenda. And I'm also in the memo, which is on page 22 of the packet, I did lay out the process that has been established in the past. And historically, reappointments have been approved. And so I just wanted to also mention that without interviews. Are there any questions? And Mike, did you
Mike, I
have
think you were
something
going
you wanted to add?
Yes, so as part of the process that Perla has laid out, there are some staff individuals that I would like to approach and have a conversation with just because of their subject matter expertise and their understanding of Central Health's mission and some of the intricacies of healthcare access and delivery. Be putting those names forward for the board's consideration. I would humbly request and appreciate that consideration, but also as we think about our partnerships and what we've learned over the past few years, also putting forward some recommendations to the board to consider when you are interviewing candidates and having deliberations and making your decisions about what it is, what does governance mean, especially in light of where we are today in our healthcare equity plan and what we're trying to do in the communities. What is it that we need in those board appointee relationships to effectively govern and come together as an enterprise or as a partnership if it's not a specific enterprise appointee. So anyway, more forthcoming on that. Thank you.
Thank you, Mr. Kiesland. Manager Musaitu.
So I propose perhaps this will be helpful for especially for those who we have who are seeking reappointments to these boards, to actually either in writing or to present to us why do they want to continue on this board, and highlight some of their major accomplishments or things that they've really learned throughout this board and why are they the best person to be on that board. I think we haven't had that in the past. It might be helpful for us to learn more about the work they do. So it's just proposing this as a recommendation. Perhaps we want to consider it.
That's an excellent recommendation. Thank you. Appreciate that. Manager Jones.
I concur with my colleague, Manager Masaichif, on that recommendation. I just have a question that may not, it's entitled Appointments Update. Has Central Health, Mr. Geeson, been approached at all by the city or the county to the creation of this Public Health Commission as being part of the implementation of that? And if so, can you talk, and maybe this is not the appropriate, but appointment, is there any request for appointments from Central Health?
There has not been a request for appointments, only notice that we have ex officio status on that commission.
Manager Masaichif.
Can you elaborate more on that?
Well,
Or no, that's fine. We cannot.
yeah, I would rather that happen in an offline conversation. I think, are you asking what a ex officio means, or, I mean, I know you know what it means, but what is our role as ex officio? If you could have that conversation.
We can have that on Friday.
Thank you very much. Any other questions, comments? Manager Valdez.
Yes,
Sorry.
and my question was this, Mike, I was listening to you talk in terms of the appointments that are needed on these three entities, you know, community care needing 1 member, Sendero needing 2 members, and integral care needing a member. And you were talking in terms of maybe possible consideration of staff because of their expertise, subject matter expertise. If you can, I'm sorry?
And knowledge of mission.
Oh, yes.
Central
No,
Health
no.
mission.
Yes, of course. That to me goes without saying. Since they're employees here, they should know what our mission is. But with respect to that, if you have some people that you are thinking about putting forward, and this is true for all your staff members, if they're already sitting on other boards and commissions, what are they sitting? What boards and commissions are they sitting on?
Sure.
And in what capacity? So what is the relationship between us at Central Health and those outside entities? And how does that impact what we're doing here? Because let's say somebody's sitting on an outside entity that we're funding. You know, those kinds of things are important. And so if that's information that can be provided for us, maybe we don't have to discuss it in public, but if we can have an opportunity to maybe discuss it in executive session, I think that would be a good idea. And with respect to the previous suggestion, that was an old suggestion of mine several years ago. So I appreciate it being brought forward again because it did make sense to me.
Great. Thank you for that. Mike?
If I may, that would be part of the process of putting names forward, whether it's internal or external, to be able, they need to disclose anything and everything that they're on so that you can have line of sight. Thank you.
Thank you, Mike. And members, you'll be getting a email requesting your recommendations for appointments. Also, if you have individuals that you know who are interested in being on the board of Sendero and Integral Care or Community Care, please feel free to provide those names to us, and staff will reach out to them and have them fill out the necessary information for the process. Managers.
One quick point of interest. Are you replacing myself?
No, you're up for reappointment. That's what the memo says.
Just one of you. One.
We have to introduce myself
We appoint 3, and the request from Integral Care was the reappointment of Hal Katz and Dr. Guadalupe Zamora.
Because I'll add here, I think you're asking about Trish Young Brown. She was reappointed last year, so her term is not up. Yeah.
Are you asking for another appointment?
No.
Oh, okay.
For the new
I misunderstood that
appointments that we have for Sendero, I'm asking for board members to give us names of individuals. That's correct.
Yeah.
We understand
that.
Are you with me now?
So, Dr. Bell.
I guess. I'm tired.
Long day.
Yeah, we have two board members who resigned from the Sendero board. So I need two new board members to replace those for Sendero. And those are the ones that we're asking. And then you heard the recommendation of both Manager Valdez and Manager Musaiti with regard to those reappointments. There should be some information as to whether they still want to be on the board, what are some of the accomplishments, et cetera, that are brought back to the entire board. So that was a little summary of our conversation. Okay, Manager Valdez.
So I apologize for, I think, Dr. somewhat a misunderstanding, because according to me, I even wrote down under integral care, you needed one board member. But I think the way it's worded under integral care, I would have written it a different way. You know, I would have said, you know, Tricia's term is not up, and the other two, because we appoint 3 people, the other 2 are up for reappointment, and we're recommending that they be reappointed. And so there's no new appointees needed for integral care board.
That's correct.
Okay.
The way
I
Cynthia wrote, spoke, it sounded like y'all were replacing us.
No, it sounded like there was a need for one.
Well, that's not, yeah,
Understood.
she
I
misunderstood.
Yes.
Okay.
Thank you.
Mm-hmm. Anything else? Okay. Agenda item number 5, confirm the regular executive committee meeting date, time, and location. Managers, our next Central Health Executive Committee meeting is tentatively scheduled for Wednesday, September 7th, 2022 at 5 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez Street, Austin, Texas, 78702. At this time, I'm ready to accept a motion for adjournment. I have a motion by Manager Valdez. I have a second by Manager Zuniga. Any discussion? All in favor? Aye. Any opposed? Motion carries. We are adjourned. Okay, members. I will bring up and call to order the agenda script. Okay, managers, today is still August 24th, 2022, and it is 6:03 p.m. As a quorum of the board is in attendance, I'd like to call to order the meeting of the Central Health Board of Managers. The first item of business will be the consent agenda. Consent agenda C1, approve the minutes of the Central Health Board of Managers July 27, 2022 meeting. C2, receive and ratify the Central Health investment for July 2022. I need a motion. Manager Valdez.
I move that the committee, the board, approve the consent agenda items C1 through C2.
I have a motion from Manager Valdez. I have a second from Manager Zuniga. Any further discussion? Manager Musaiti.
Yes, and this was actually a text that I had going on with Brianna yesterday for further clarification. On C2, the item that we had voted for, and C3. So for C3, we voted for it during our strategic and planning committee meeting. Did we have a vote?
We discussed it.
We did not vote?
Well,
we had a vote. That's what's confusing me because I was present.
Okay. In strategic planning, we discussed that item, and strategic planning made a recommendation to the full board, which was held the same day.
Yes.
Okay, so on our agenda, we had the recommendation from the strategic planning committee. However, Manager Jones pulled it. So in essence, we had to pull it from the consent agenda. We voted on the rest of the consent agenda, and then we pulled up C3, I guess, and we voted on that separately.
We had 2 votes. Isn't that correct?
Well, it was a vote on the consent agenda, and it was a vote on C3.
Okay, that was my just needed further clarification. I forgot what happened during that day, because I knew.
It's indelibly written in my memory, so I'm just kidding.
Thank you, that's it.
Okay. So I have a motion and a second for the consent agenda. All in favor? Any opposed? Motion carries. We'll now move to the regular agenda. At this time, I'd like to entertain a motion to limit debate for all items in the regular agenda for our meeting this evening. Manager Greenberg?
I move to limit debate to 5 minutes for all items in our evening.
Thank you. Oh, your microphone. Repeat that motion.
I will repeat it. Is it on now? Yes, I move to limit debate discussion to 5 minutes for all items on our agenda this evening.
That's fine. Do I have a second?
Second.
Per member.
That would be per our usual per member.
Per member per item.
Correct, per member.
It's just a slight touch that you have to. There it is.
Per member per item, yes.
Thank you. I have a motion by Manager Greenberg. I have a second by Manager Valdez. Any further discussion? All in favor?
Aye.
Any opposed? Any abstaining? Motion carries. Members, we will be taking one item out of order in the agenda this evening. We will go into closed session for item 8, just after item 1. We have outside presenters for closed session, and we would like to be respectful of their time. Agenda item number 1, discuss and take appropriate action on the proposed amended mandatory payment rate to be assessed on institutional healthcare providers during fiscal year FY 2022 under the Local Healthcare Provider Participation Program, LPPF, in Travis County as required by the Texas Health and Safety Code, section 298E.151. Katie Coburn will be presenting. Hi, Katie.
Hi, Dr. Bell. Hello, Board of Managers. Brianna, do you have access to my presentation or should I share from my computer here? There we are. Thank you for your time this evening. I am here to present Central Health Staff's recommendation to the board that you increase the FY22 proposed mandatory payment rate to 6% of net patient revenue. This, as we have been before you several times this year because of such significant uncertainty in these funding sources, we are returning one last time to recommend an amendment to the FY22 LPPF rate. That amendment would bring the rate to 6%, and 6% is the highest amount that the rate can be set per law, per our enabling legislation. The funds that this amendment would generate would be an additional $45 million on top of what has already been assessed in inpatient hospitals in Travis County. And the purpose of this amendment is to ensure full access to federal funding for the Comprehensive Hospital Increased Reimbursement Program, or known as CHIRP, the second and final payment of the year 2 of the program. If you could go to the next slide, please. So just as a reminder, I know we've talked a lot about this before, but the LPPF mandatory payment is set as a uniform percentage of net patient revenue of all Travis County inpatient hospitals. There is a requirement that this payment rate be what's known as uniform and broad-based, which means we are statutorily required to have a proportional assessment on the net patient revenue of all hospitals in the same class in the jurisdiction. So all inpatient hospitals are assessed the same percentage of their net patient revenue. The rate is set by the Board of Managers. Central Health then acts as in a fiduciary capacity as the LPPF administrator and completes intergovernmental transfers to leverage the federal supplemental payments that the transfers are required to achieve. We collaborate with hospitals on the uses of these funds, and just as a reminder, the disproportionate share and DSRIP programs are prohibited from our legislation for using LPPF funds. Our current rate right now is 4.71%. And again, the uncertainty in the program funding levels has really required us to amend this as we go through this year to maximize federal funding to the community. So one more slide, please. And so this is just a summary of where we've been for FY22 and this rate. The 6% amendment would generate an annual total of $209 million. Again, that represents about $45 million in addition to what we have invoiced so far through the other payment rates that you see that you approved throughout the year. I'm happy to take any questions.
All right, thank you very much, Katie. I appreciate it. Any questions, Manager Musaitis?
Thank you, Katie, for the presentation. You mentioned that it's uniform, so the payment, so it's across, the payment will be similar regardless of the hospital size and revenue?
The percentage that is assessed of the net patient revenue is what is uniform. That is uniform. The other uniformity is that it's in all hospitals in a specific class. So inpatient hospitals in our situation. So the amount of revenue that's generated for each provider is proportionate to what their net patient revenue is for that year.
Okay, thank you.
Manager Valdez.
Yes, Katie, if you don't mind, can you clarify what the class is, what you mean by class? If we have large facilities and then we have much smaller facilities, are they all still in the same class because they're providing the similar services, or?
That's correct.
Is that what I'm understanding?
Yes, that's correct.
So regardless of whether you're large or small, you're still in the same class, and you will be assessed that 6% based on the revenues that you're bringing in, correct?
Correct.
Okay. Is there ever a distinction made between services that are being provided? Let's say the larger hospital systems can provide many different kinds of services for their population. The smaller facilities may not always be able to do that. Does that make a difference or not?
It does not in terms of the classification of the hospital.
Okay, so as one of our speakers today presented to us, the fact that they're only a small for facility system, it still doesn't make a difference compared to Scott and White, Baylor Scott and White, or St. David's, or Ascension Seton, or anybody else.
Well, it doesn't make a difference in the fact that they are assessed the same percentage of their net patient revenue as all of the other hospitals. Now, if their net patient revenue is much smaller, they will pay a much smaller amount into the LPPF. If their net patient revenue is bigger, they pay a much larger amount.
That's the consistency.
That's correct.
Regardless of your revenues. Okay, thank you very much.
Any other questions or comments? Manager Jones.
Just have a quick question. Can you just quickly go over the systems that currently are provided? That we know the larger ones, but this one that I heard today was the first time I was familiar. Are there other ones that we're not aware of?
So there are, I have my list here. There are 22 facilities in Travis County that we assess the mandatory payment for the LPPF. The 6 Ascension Seton facilities, 3 St. David's facilities, 3 Baylor Scott and White, And then there are several others, Austin Oak Hospital, Austin Lakes, Family Hospital Systems, as you heard from earlier today, smaller hospitals that are qualified as inpatient, our classes inpatient hospitals in the county. That's how they are defined with the Department of State Health Services in their licensing. So all of those facilities receive an assessment through the LPPF.
Would you like a list, Manager Jones?
That would be helpful.
I'm happy to provide that.
If you could send around a list to the board members, that would be great.
Certainly.
Thank you. Manager Masai.
Katie, from the 22 that you've listed, how many supported and how many objected to this tax rate?
The only one that I'm aware of is the one who spoke this evening. Everyone else has been in support or
Any other
not
questions?
opposed.
Thank you. Manager Motwani.
on it. Yeah.
I'm not as good at this. I think I might have a dad.
Yeah, go brother. Thank you. Are we green? Yeah. Forgive me. Chair Bell, I'm wondering if there's any precedent for, this is new to me as well, or at least the concern that the caller shared around the disparities, potential disparities anyway, and what would be paid into LPPF. And again, you know, it's one thing if we're talking about incomes of individuals or families, and the wide range of percentage may not be necessarily a true adaptable rate. You know, so we have we had progressive income taxes, right? But here, I'm guessing that to operate, you know, as an inpatient hospital facility, there's likely some degree of margin that makes that, you know, operating margin that makes that not as much of a concern. However, to hear the concern be voiced without getting into the P&L of the organization, I'm asking if you might be able to share from your own expertise or call on staff or other board members who also have that expertise of any history or context around this, and what maybe, you know, if this has been brought up before, or, you know, what options really may be on the table in as much as potentially slicing and dicing in as much as number of beds, etc.
Katie, you look like you were, our lawyer is talking. Hold on.
You mind, Katie? What Katie said is of course accurate. She knows this as well as I do, probably better. That provision for proportionality of assessment is directly from the statute. And any that it also qualifies it with as consistent with federal law in that section of the statute. And at some point, the feds, because of the way this system works, the feds will become interested, and any parsing that differentiates among systems is going to get, and Monica even suggested we might want to go into closed session to talk about this, which is why I'm talking. We're getting to the point now where we're treading on potential federal implications of HHS OIG, and don't want to talk about that out here. And so we are being consistent with statute, because it says if you're going to assess it for one, you assess it for all, and assess it the same.
Thank you, Chair. That's enough for me, at least for this year.
Thank you, thank you, Manager Motwani. Very quick, Manager Valdez.
Very quickly, Katie. The hospitals, the 22 hospitals that are operating under this LPPF system, are there any that are maybe single function? Are there? I know that we have hospitals that concentrate on mental health. We have hospitals that substance abuse. Do we have any of those hospitals that are within the 22 that we're talking about? And the only reason I'm asking is because if you're going to give us a list, then I'd like to know which of those hospitals provide what services. That's the only thing, the only clarification I would like to have.
As part of the list?
Yes.
to the extent that I can find that, I will certainly provide it. The information I get is from the Department of State Health Services and their licensing data.
Right.
So that's how we determine the list, and I will share what we have on that.
I appreciate it. Thank you.
Thank you very much, Katie. Manager Jones.
Just one quick question. Can you also geographically, when you provide the list, where they are located in the county so that we have a picture of that? Is that available?
Because they are not in the Eastern Crescent, I can tell you that.
I'm sorry.
They are not in the Eastern Crescent.
That's why.
Yeah.
I can certainly provide addresses, and I will talk to staff. I don't know what mapping abilities we have, but we will see what we can do.
Katie, the other thing is, if there is a way, and I know that the information that you're getting is from the Department of State Health Services. So you're really just looking at a name and maybe some other identifier. If there's any information with regard to location, as you've heard, Manager Valdez would like the demographics served. And I think that Manager Zuniga also said.
No, I already know where they are. I don't need demographics. I can tell they're looking. I know about them. I
Right.
don't need any information.
But you
about them.
just need the geographic,
Nope, I
right?
know where they are. I don't
Oh,
need it. It was-
okay.
yeah.
Manager Jones.
Jones. All right, sorry.
Yeah.
I got pulled out of a conversation, so. As much as you can get that information that's possible, I don't know that that's gonna all be available to you. But if you can, that's great. Manager, Mr. Giesman.
Thank you, or Mike, please. So members, I know Katie's copiously taking notes, and we'll go back and assess what information we have on these different facilities, because as a validating source, we go to the state, as she mentioned. But if this looks like it's starting to go from answering some basic questions to turning into something of a little mini report, I'd like to come back to the executive committee.
Thank you.
Stage it properly, but also knowing you've got to take a vote tonight, but then there's a bunch of other things that are coming up. And so that helps to stage the work properly, but also being responsive to what it is that you need. Thank you.
Okay, thank you very much, Mr. Giesman. I appreciate that. Okay, a manager, very quick. Oh, you're gonna give me a motion.
I was going to give you a motion, Dr. Bell.
All right, Manager Valdez.
I was going to, because y'all can't hear me. Okay, I move that the board adopt or approve rather the fiscal year 2022 LPPF rate amendment as proposed by Central Health staff.
I have a motion by Manager Valdez. I have a second by Manager Zuniga. Any further discussion? Hearing none, all in favor? Any opposed? Any abstaining? Motion carries. Thank you, members. I appreciate that. Agenda item number 8, receive and discuss updates on the 1115 Medicaid waiver, delivery system reform incentive payment, DSRIP program, and associated projects, the Community Care Collaborative, and other healthcare delivery partners, programs, projects, and arrangements, including agreements with Ascension, Texas, and the University of Texas at Austin. Members, I now announce that the board is convening in closed session to discuss agenda item number 8 under the Texas Government Code, section 551.071, consultation with attorney.
Yeah. Después del tole, it's already done. She's watching House with Gloria. Yeah, she's been more tired. One that's part of that.
Ayla, this is the boardroom. Can you hear us?
Out of the 8. I don't know if it's ARC or ABC, whatever it is.
Yes, Mike.
I'll take it to you tomorrow.
Great. Okay, members, we are out of closed session. Again, August 24th, 7:50 p.m. I would like to take up agenda items 2, 3, and 4 together. Agenda item number 2, receive and discuss a presentation on proposed Central Health FY 2023 budget and tax rate. Agenda item number 3, discuss and take appropriate action on Central Health's proposed property tax rate for FY 2023. And agenda item number 4, set the date, time, and location for the public hearing at which the Central Health Board of Managers will present and receive comments from the public on the. So, agenda item 2, Mr. Giesland and Lisa Owens will be presenting.
Yes, thank you, members. As noted in the agenda item, there's really 3 things we're talking about: the budget, the tax rate, and the setting of the public hearing. Mic is on.
It's on.
Mic's live. Lisa will cover the budget and the tax rate, noting changes since the last time that you saw the budget. Remember, the budget really is comprised of 2 parts, Schedule A, Schedule B, and that is tied together with a budget resolution to the strategic directives set by the board. Lastly, there are a number of slides that you've seen before, but that are included in an appendix. We're not going to go over those slides, but if we need to pull those back up and have some discussion around them, we certainly can do that. So at this point, I will turn it over to Lisa.
Thank you. Good evening, Lisa Owens, Deputy CFO. So as Mike mentioned, we've moved some of the slides in the packet to the back for appendix. Those were gone over at our last meeting in detail. And we're going to focus on some highlights tonight of what has changed since the preliminary proposed budget. But our primary purpose for being here tonight is a request that the board take action. This action starts a process of posting for the public hearing, which is next Wednesday, and establishing a property tax rate that could be adopted. It's not being adopted at our meeting on September 7th. The tax rate that we are proposing supports the total uses of funds of $302 million. And that is about 92.7% healthcare delivery and 73.3% administration. As you know, we work to maintain the lowest property tax rate of our peers throughout the state of Texas. This is a look at last year's comparison. And as you also are aware, as our taxable assessed values continue to rise, this is why you're going to see a decrease in the tax rate this year, because even as those property taxes rise, the rate will go down in order to bring in the same amount of revenue. And as we are proposing tonight, 6% over that no new revenue rate, which, as we've been meeting since May to discuss, will support the funds that will be needed over the next 8 years to support new initiatives, which we're excited to deliver in this year's budget, such as the direct practice of medicine and opening specialty care clinics. We've shared this before. The property tax rate is proposed at 9.8684 cents per $100 of valuation. And we have the homestead and 65 and older and disabled disability exemptions at 20% for the homestead, which is the maximum allowable by law, and 110,000 for those other two categories. We also are just showing a comparison of the current proposed rates for the FY23 average taxpayer who lives in these jurisdictions. The central health portion of their tax bill would be just about 4.5% of that total tax bill. The property tax assessed values are appreciating. This shows what we call the bands, the different types of home owners in these areas, and what we anticipate could be the financial impact to them in this coming year. As you know, and as we talked about at our last meeting, we anticipate that the overall bill to central health will go down by about $4 for that average homestead person who lives in Travis County. So tonight I'm going to walk through what's changed since we first started. It's very minimal, but there have been some things that have arisen that we felt the need to adjust the budget as we just continue to work together and learn more about the needs of the programs that we've been developing through our business case process and the support that would be needed in order to implement all of that. So on the sources, the change in the property tax is really due to the exact calculation of our tax rate, which is a process that we went through after our first meeting on the 27th of July. And that is the official tax rate calculation from the state. We use that, and that changed the number a little bit. And as a result, the property tax is estimated to decrease by about $100,000. I'll go through the uses on the next few slides, but we did see about $2.8 million in our uses of funds. And as a result, our contingency reserve, which we have taken out of our sources and uses this year, we would anticipate that would be about $330 million at the end of the fiscal year as available source of funds for those future projects that we've talked about and those reserves that will be needed to ensure that we maintain a strong cash position with those days of cash on hand. So again, we put some little asterisks on this to show you, and I'll just talk through some of this. We have increased our specialty care by about $900,000 in the areas of ophthalmology and oncology. We've also added just a slight amount of funds to post-acute care as some additional needs were identified. And we've learned just as early as today, or yesterday, I guess, that there could be some changes to the 340B program. And so we've increased our budget in pharmacy by $1 million. So all in all, about a $2 million increase in purchase services. Again, those are the purchase services where we contract with providers throughout the community to deliver care, including our primary care partners like Community Care and others. So there's a $2 million increase. In the next section, there's some minimal increases throughout this presentation in the areas of salaries and benefits as we fine-tune the percentage of benefits and salaries. We also learned more about a lot of the physicians that we're looking to hire might be a partial FTE, a full-time equivalent. So those slight modifications resulted in the salaries actually decreasing a little bit in that area. And then also by adding FTEs, sometimes there's a very minimal increase there. We also had an increase, and so my point being, indirect healthcare services, this is primarily staff. We've talked, and I'll go through very quickly on one of our last slides. We will be investing in over 128 new staff this year, much of them in this space. So MAs, social workers, nurses, and the doctors, much of what is in this area is in salaries. Again, salaries and benefits, some minor adjustments in both our real estate and development area, as well as the salary and benefits line, which is about 5 rows down. And then we did increase our computer equipment and utilities for some potential computer software, as well as increasing our availability of one of our existing softwares. So we felt it was important to include those. It's about a few $100,000 in that area. Again, as we adjusted FTEs at times, we anticipate a training budget per FTE. So if that changes, that's what has changed our travel training and professional development. So in our total healthcare operations, we did have an increase of about $350,000. There was no change to the UT affiliation agreement of $22 million, and that total healthcare delivery did increase slightly, just over $2 million to $280,168,877. In administration, we did, after much discussion with leadership about the potential changes to how we operate and what we do, and being able to support that, we did include some additional salary and benefits dollars in there in the areas of finance and administration, just for planning on how we might use those to support, if needed, the healthcare delivery infrastructure. And then just a very minor adjustment between the consulting and travel training and development. So those changes, very minor, and those netted out. Our total increase in administration and tax collection was $469,000. So our total uses, again, is $302,318,237. And as I mentioned, that went up about $2.8 million. Those changes are all reflected in these updated charts. We are increasing our administration staff by about 6 FTEs. Oops, I think I skipped one. There we go. As I mentioned, in direct healthcare services, again, these are the end of year hires. Many of these staff will not be hired until the last quarter of the year, but you will see a significant increase in the infrastructure staff in order to support the healthcare delivery, and then those direct healthcare hires for the practice of medicine and the specialty care areas of 63 and a half staff. There were no changes since our initial budget of the total reserves required, but I'd just like to remind everyone that we are increasing the Rosewood-Zaragoza budget, as was presented multiple times, in order to meet our projected full budget for that project, which we are looking forward to executing on this year. And with that, I will tell you where we're at. We're at our voting on the maximum tax rate, voting on the tax rate tonight that will be posted and published in the newspaper. And that will start the process of our public hearing, which is next Wednesday at 5 o'clock. August 31st, and then finally coming back here together on September 7th in order to make that final approval of the budget and the tax rate that will then be forwarded on to the commissioner's court later in September. So no action on approving the budget tonight. We're simply starting the tax rate process. With that, I will turn it back over to Mike or Dr. Bell.
Well, first of all, thank you. And it's good to see you in person.
I know.
As opposed to on the Zoom or Ring Central. Any questions, Manager Musaki?
Briefly, thank you so much. Really appreciate it, Lisa. Going back to the specialty care, you mentioned cardiology or oncology?
Oncology.
Because I didn't see it on there.
We don't have that level of detail in this we don't have in the specialty care line. We don't have that level of detail. However, if you all remember, you will be getting that level of detail, and I can provide it offline.
I just wanted to make sure that I heard you correctly. Yes. I'm glad that there was that increase. Thank you. That was it.
Thank you, Manager Valdez.
So as we look forward to the increase in administration, I know later on, and it's not really a budget issue. Later on, will you be able to tell us how that actually fits to improving our demographics for top management? So
this is a whole conversation.
I appreciate that. Yeah, so I just wanted to make sure that whenever you do get these hired, that we can come back and look at that.
This October, November.
Okay,
Thank you.
all right.
Thank you.
Thank you, Manager Jones.
Thank you. Could you go back to the first slide that you had on the tax rates comparison, the metropolitan areas of Texas? I just have a question with regards to, are we apples to apples type of question?
Yeah.
Right there. So we're saying we have the lowest tax rate of all of the major metropolitan areas. Is that what we're saying there? Okay, is it fair to say, should we put an asterisk or something that says that we are also the only one that does not operate its hospital?
Yeah.
I know that, but yeah.
The public doesn't.
So the public.
And I think that's an important point because, yes, we want to be proud of the fact we have the lowest rate, but we need to be fair and out front and tell them, yes, but we also have a different arrangement. So that's the only comment I have to say about it.
And
Full disclosure, so to speak.
And it's been discussed many times in the past that the reason for that low tax rate is the fact that we don't have a hospital. I mean, I agree with you that we should point it out on our document, but it has, we have said it numerous times. Yeah. No, I agree. I understand. Manager Mapolani.
And this is speaking to Manager Director Jones's point. I wonder, so of course we very often discuss in the same breath as we look at that image that we don't have a hospital, and then I don't know if everything is apples to apples. Anyway, I wonder at what point does it become infinitely regressive to point out all sort of the differences? Because my understanding is that degrees of coverage may vary as well across the districts. Is that right? For example, in Harris County, would we say that folks get the same degree of coverage or the same percentage of coverage per capita by income that they're getting here or not? And so there would be a lot of asterisks, I think, at some point.
Manager Jones?
It's just
I agree, but we are the one who set up the comparison. So
that's right.
Following your argument, I would say, well, let's take that out. Let's not talk about that we're the only one, because if we start down that road with comparing our tax rate, following your argument would be, well, let's also say that Harris County has the highest this, the lowest of this, and so on and so forth. That's the only reason I raised the question, is that I think that's can be misleading to someone who comes here and say, oh, well, they operated fantastic. Well,
okay. All right. Any other comments, questions? Okay, members, as a reminder, we're on item 3, discuss and take appropriate action on Central Health's proposed property tax rate for FY 2023. As a reminder, this item is the preliminary action we must take in connection with the tax rate for fiscal year 2023. Tonight, we will vote on the proposal to decrease the tax rate to 9.8684 cents per $100 of taxable property value for the year 2022 tax year, which will support the Central Health FY 2023 budget. The final vote on the adoption of the tax rate is tentatively scheduled for September 7th after the statutorily required public hearing. The date, time, and location for the required public hearing on the tax rate proposal will be formally announced in the next agenda item, which will allow staff to publish the required public notice in the newspaper and on our website. With that, I would ask for a motion for the tax rate. Manager Valdez.
I move that the board approve proposed total property tax rate of 9.8634 cents. I'm sorry, 9.8684. I thought that's what I said, but I guess not. Excuse me. Cents per $100 of taxable property value for the 2022 tax year. Which will support Central Health's fiscal year 2023 budget.
I have a motion by Manager Valdez. I have a second by Manager Musaitis. Any further discussion?
For efficacy, could you repeat that exactly again?
Okay, I move that the board approve proposed total property tax rate of 9.8684 cents per $100 of taxable property value for the 2022 tax year, which will support Central Health's fiscal year 2023 budget.
We clear? Okay. Again, we have a motion by Manager Valdez, a second by Manager Musaitis. Ms. Brianna Yanis will now assist me in taking a roll call vote because a roll call vote is required for this action item. For the roll call vote, Ms. Yanis will call the name of each board member in attendance in alphabetical order. Each board member must indicate whether they are voting yay or nay or abstaining from a vote on the proposed tax rate. Ms. Yanis will confirm your vote before moving on to the next member to ensure that we have an accurate vote tally. To ensure compliance with the requirements of the Texas Open Meetings Act, each manager should wait to voice their vote until the camera is directed at them and Mrs. Yanis asks for their vote. Are we clear? Okay.
Okay, and I'm actually gonna go from right to left to make it easier on the camera. So with that, I will call the roll. Manager Shannon Jones.
Yes.
Manager Shannon Jones votes yes. Manager Maram Musaitif.
Yeah.
Manager Maram Musaitif votes yes. Manager Amit Matwani.
Yes.
Manager Amit Matwani votes yes. Manager Sherry Greenberg.
Yes.
Manager Sherry Greenberg votes yes. Secretary Cynthia Valdez.
Yes.
Secretary Cynthia Valdez votes yes. Chairperson Dr. Charles Bell.
Yes.
Chairperson Dr. Charles Bell votes yes. Treasurer Julie Zuniga.
Yes.
Treasurer Julie Zuniga votes yes. Manager Dr. Guadalupe Zamora.
Yes.
Manager Dr. Guadalupe Zamora votes yes. And I don't think Vice Chair Dr. Cynthia Brinson is online.
I don't think she's on the line.
She's not even in attendance.
Yeah, she's not.
Okay. We have a unanimous vote, and the motion passes. Manager Musaitis.
General comment. I feel Dr. Zuniga should also be addressed as doctor. She holds a PhD. So I just want, out of respect to her background, if we all be consistent with our credentials.
Manager Greenberg.
I have an even different one that I have voiced before, which is we should all just be addressed by first name, last name, and then we can dispense with all those different credentials and
That's
be
right.
equitable.
I'm with you.
I agree with you.
Okay. We will refer to each other as their first name, last name. I think they're located there, and as managers.
Manager.
Thank you.
Yeah.
Okay. Agenda item number 4. Set the date, time, and location for the public hearing at which Central Health Board of Managers will present and receive comments from the public on the proposed FY 2023 tax rate. Manager Valdez?
Yes, may I make a motion?
Yes, that's what I'm.
I move that the public hearing on the proposed tax rate be held on Wednesday, August the 31st at 5 p.m. at Central Health's Administrative Offices, 1111 East Cesar Chavez Street, Austin, 78702. A notice for which will be posted on the Central Health website and published in a general circulation newspaper in Travis County.
Do I have a second? I have a second by Manager Motwani. Okay. Any further discussion? All in favor?
Aye.
Any opposed? Any abstaining? Motion carries. Members, before we move on to this item, I would like to emphasize to the members of the public that are watching that even though a quorum of the board will be meeting in person, the public can still participate virtually in the tax rate public hearing. We strongly encourage all members of the public to participate in the meeting. And if you do so virtually, there will be a virtual link that will be provided in the notice and to submit any comments through that method. Agenda item number 5, receive the fiscal year-to-date healthcare services expenditures made by and accept the preliminary July 2022 financial statements for Central Health and the Community Care Collaborative. Lisa Owens will be presenting.
I will start with the Central Health financials through July 31st. Our total current assets were $432 million, and our restricted cash and investments were $222 million. Total capital assets at just over $85 million for total assets of $740 million. We had current liabilities of just under $18 million. We also had funds held for the LPPF, which are an asset and a liability of $18 million. Total restricted and non-current liabilities of $94 million. Total liabilities as of July 31st at $112 million. Our net assets as a result are $627 million. So total liabilities and net assets at $740 million. Our property tax revenue, we continue to see very small amounts of that come in, but we are just under our budget, but at 100% of our target of $260 million. Oops, sorry about that. Lease revenue and other revenue, as well as tobacco settlement, which came in earlier this year. Total sources of funds in July were $1.5 million. Our healthcare delivery was $24 million. I'll go into more details on that on the next few slides. In our administration program, our year-to-date expenditures are 54% of our budget, budgeted $13 million. And as we talked about at our last meeting, we do anticipate being a little under budget there, which makes up some of the changes in that year-end estimate, which we went through last month. So our total sources and uses for the month were negative $24.2 million. We did have our intergovernmental transfer, which was budgeted, come in as a result of some of the COVID accommodations that were made. It was just under budget at $15.385 million. That was transferred in July. And primary care and other healthcare services, just under $6 million through July, in the month of July, $56.7 million year to date. Our ACA premium and assistance programs are at about 79% of their budget. We do anticipate fully spending those funds this year. Healthcare facilities and campus redevelopment at about $3.2 million year to date, and our healthcare delivery operating costs at 16.7. Our total subtotal of those healthcare delivery costs were at $87 million, about 56% of the budget. Our total healthcare delivery year to date is $122,485,302. A little more detail on the healthcare delivery. We have talked through most of these. I will talk about the healthcare delivery operating costs. That's budgeted at 35 million, but as we talked about last month, we do not anticipate spending that full 15.5 million on other goods and services. So we will be under budget in that area at the end of the year. Those resources will be available as part of our contingency reserve, but we are at about 50% of that budget year to date. Our primary care by provider is outlined here, and also specialty care by specialty, as well as some additional notes. We are at $6.2 million year to date, which is about 1.5 million additional funds year over year of a total budget of 11.9. And as we've broken out at the bottom, additional funds for expansion that were available but have not been spent. So our total specialty care is $6.3 million. I'm happy to answer any questions.
Thank you very much, Lisa. Any questions? Okay, you'll go on with the community care collaborative.
So in the Community Care Collaborative in July, we had our IGT at the end of the month, as I mentioned in Central Health, provided that $15 million in IGT, and over $45 million came into the CCC as a result of that. However, it was in transit on that last day of the month, so the balance sheet is as of a day and time. So you'll see that as a receivable. That $46 million is just one part of that is that intergovernmental transfer, which did arrive very early in August. We also had accrued liabilities. The year over year is very similar. We do 30 days out record the liability for the UT affiliation agreement. That payment was made in early August. Deferred revenue, as we've talked about, $9.3 million does have to do with the ongoing look at the revenue we receive for the DSRIP program. We continue to have analysis done by the state's provided auditors, but so far no findings, but we do keep that reserve there. Total net assets as of July 31st at $7.4 million, and total liabilities and net assets as well as total assets at $57 million. As I mentioned, we did record that DSRIP revenue that was en route. So our total sources of funds for the year was just under $54 million. In our healthcare delivery program, we have additional details on that $11 million, but we are pretty close to our prior year actual year to date in those programs, as well as the UT services agreement. And then the DSRIP project costs, as we get additional information as that program winds down, we do have just $5.4 million in there. We do anticipate being closer to that 12 million towards the end of the year, but not at the full 12 million. So our total uses of funds, just under $51.5 million. And again, our net assets are $7.4 million. In the healthcare delivery, $11 million. A lot of that is made up of our specialty behavioral health for our inpatient services and post-acute care, as well as a little bit of specialty care. A total of 57% of our anticipated budget, which you'll recall is the FY20 approved budget, is has been expended in that program, healthcare delivery. And again, I can answer any questions on the CCC.
Okay, thank you very much. And, Lisa, thank you for, your ongoing presentations to keep us up to date with financials, but also thank you and the staff, Jeff, with regard to the developing the tax, the budget development for FY23. and all of the work that goes into the development of the tax rate and the development of our budget. So we really, really appreciate you. Okay, any manager?
Yes, thank you all. On the CCC payroll, who's on the payroll there?
So the CCC has staff that are. The CCC has staff working on behalf of Central Health that are assigned. They have an executive director.
Who's the executive director? John Morgan? Okay. So in the future, if you can provide me with, just out of curiosity, who's on the CCC? Are they strictly just CCC employees, or are they joint Central Health CCC? Just out of curiosity, how the structure works. Sorry, I couldn't hear you. The ambulance.
So I'm partially assigned, and then we have some staff that are providing support for the district program while it's being closed out. And I think that's all of the staff.
Okay, thank you.
Okay, any additional questions? Seeing none. Thank you again, Lisa. Appreciate it. Agenda item number 6, receive an update on the Central Health dashboards associated with service level reporting for FY 2022. Members, there are materials in the backup for this item, but there's no presentation. JP Eichmiller and Ashley Levelet are available if you have any questions. Okay.
Thank them for giving us the dashboard. Thank you, Sherry, for pushing for that.
Thank you very much. And thank the staff for the dashboards. They're extremely informative and definitely provide a lot of information to inform not only our budgetary decisions, but our other policy decisions as it relates to the healthcare that we provide to individuals within the safety net population. Okay, agenda item number 7, receive and discuss an update on Central Health Enterprise branding. Mike Giesland and Ted Burton will be presenting.
Yes, members, I'll tee this up and then I'll hand it off to Mr. Burton. We are dusting off this issue. This is not the first time this board has seen this, although perhaps maybe for some of the newer members. It is part of the last 5-year performance review to consider enterprise branding and better brand awareness. Tonight's endeavor will be brief, but it's just to simply reset the baseline level of knowledge so that when we do come back to you for additional communication, including communication with enterprise partners, everybody has a good working baseline knowledge. There is no ask for tonight, although at some point in the future, we will ask for direction, perhaps through motion or resolution, to express the will of this board so that we know how to work throughout the rest of the enterprise. Ted. Light touch. The little one at the bottom.
Got it. Okay, it's working. Hi, everybody. My name is Ted Burton, Vice President of Communications, batting cleanup again this month with a brief presentation on enterprise branding. Now we can go to the next slide. Really, this is a quick history lesson of where we were, where we left off with the enterprise branding initiative about 3 years ago. It was abruptly put on hold due to COVID-19. In fact, our last presentation to you was in February of 2020. We all know what happened in March of 2020. So as a quick recap, the goal of the Enterprise Branding Initiative was to help Travis County residents, especially our patient population, understand the enterprise affiliates and how we're connected. So Central Health, Community Care, and Sendero. Objectives, we wanted to connect the enterprise brands and products, showcase the collective value and strength of the affiliates and what we bring to the community, and then use branding to create a platform for clear communications about healthcare for people with low income, how it's planned, delivered, and funded in Travis County. Next slide. So the genesis for the Enterprise Branding Initiative was the 2017 Germain Solutions Performance Review, which was presented to you and Travis County Commissioners in 2018. One of their findings was essentially that there's confusion among constituents regarding the relationship between Central Health and the affiliates. You're out in the community. I'm sure you experience this. We experience this. This challenge continues. And the recommendation of Germain Solutions was to create a marketing strategy similar to the Intel Inside campaign so that the community recognized the value that the affiliates and the enterprise brings through our network. So what did we do? We conducted stakeholder peer research first, which was looking at similar organizations around the country that had been through a branding or unified naming system initiative, and we showed you some of that, and we will again. We conducted stakeholder interviews, 24 interviews with Central Health Enterprise staff, executive board members, elected officials, community members, and patients. Some were face-to-face, some were over the phone, and some were submitted in writing. And the interviews were conducted both in English and in Spanish. We also conducted focus groups, 5 focus groups comprised of current patients, non-patients, Travis County residents, and Central Health Enterprise employees. And again, those focus groups were also held in both English and Spanish. And the goal of the research was to understand the current state of the affiliates and the branding, perceptions about the current names, and we probed and explored some different naming options during that research. We can go to the next slide. Last fall, we presented to you our 2021 awareness survey, and it showed some interesting and significant progress. And we reported this to you, I believe, in November. All Central Health Enterprise organizations performed strongly among current patients in relation to awareness and favorability. The enterprise organizations improved notably in awareness and favorability among Spanish speakers, Hispanics, and African Americans. Since 2019 showed that our efforts to reach these communities of color were working. And specifically when it came to Central Health and Community Care, you can see dramatic increases in awareness among our Spanish-speaking people that were surveyed. So 20 percentage points for Central Health and 18 percentage points for Community Care. And finally, Central Health awareness had risen across all ethnicity segments, particularly among African Americans, where it increased by 10 percentage points. We also reported to you that we got high marks along with Community Care for our response to COVID-19 during that survey. Next slide. Here it is. This is where we currently stand. You can see for yourself, if you just look at these names and logos, you'd have no idea they were connected. There's nothing that makes us appear to be part of an enterprise. And so one of our goals is to create consistent communications and marketing when we're out in the community connecting with people, specifically our patient population. And we hear this a lot, trying to explain what Central Health is, what Community Care is, and how we're connected. Next slide. So these are just some examples only of names. No decisions have been made, but these were some of the things that we showed to you back in 2020. For example, under Central Health, adding a descriptor or explainer line. We often in communications say Central Health, the Travis County Healthcare District or Hospital District. And so why not make that part of our name so it's out there? And then just an example of, for example, when RZ opens up next year, how that might be named or branded. And then finding a way to connect community care and central health. Again, this is an example, no decisions have been made, but community care Southeast by central health, so that people know that we are co-applicants for the FQHC status, and we are our partners. And then community care Bastrop and Sendero health plans by central health. Again, these are just ideas only. And also you'll notice that we did try to use geography as part of the naming, because we often hear from patients that they say, oh, I go to Southeast or I go to North Central. So that's just a natural way people talk about our health and wellness centers. So next steps. We want to continue to develop and work with our enterprise affiliates to create an enterprise naming system. Then we would move there to begin to develop the actual logos themselves. So colors, fonts, all the things that would connect us just from a look and feel perspective. And then develop a rollout plan that would include a timeline and budget. So that's where we are as of tonight. I'm happy to answer any questions that you might have.
So thank you, Ted, for bringing this back. Again, we wanted to give you a baseline knowledge and also emphasize in those next steps that this, Dr. Bell, you've strongly encouraged this as well. It will be done with the other enterprise partners. It's not just a one-way directive or edict. It's with the board members and those executive partners there. So being an enterprise family affair, like a lot of family endeavors, it's going to take a while for us to get there, but we will get there. Thank you.
Thank you, Mr. Giesland. And I truly support this to be a collaborative effort. Not only the executives from the other enterprise entities, but also members of their board. And let's talk about, how we get to the final product of a unified naming system is what I would call it. All right. Any other questions or comments? Okay, hearing none. Thank you very much, Ted.
Thank you.
And we'll hear from you again, I think next
September.
Yeah, next month, real soon.
Yep. Thanks.
Thank you. Agenda item number 9, confirm the next regular board meeting date, time, and location. Managers, our next Central Health Board of Managers meeting is tentatively scheduled for next Wednesday, August the 31st, 2022 at 5 p.m. at Central Health Administrative Offices, 1111 East Cesar Chavez, Austin, Texas, 78702. At this time, Manager Greenberg will provide us with a motion for adjournment.
I move adjournment.
And Manager Valdez seconds. All in favor?
Aye.
Any opposed? Any you're opposed?
Go for it, Shannon. Yeah. That's it, Shannon.
Any abstaining? The motion carries. We are adjourned. Thank you, members. I appreciate it.
This was not on my schedule. I don't know